everybody, welcome back to Culturally Prescribed. I'm Nana.
Rod.
Mark.
Tayo.
And I'm Robert.
And today we'll be having a beautiful discussion with Mark, who is a fourth-year student at Ohio State University, and he's currently going through his residency application cycle. So hopefully he can give us, as well as you, some insight on how that's exactly going. Briefly, how's that going for you?
It's going. Basically, just for everyone who's listening or watching in this case, the residency application cycle is similar to all the applications you've basically applied to get into medical school up to this point, such as the AMCAS application and so forth. What's the name of it is called ERAS, and basically it's set up as in, it looks almost similar to the AMCAS. So you have the different sections, like your bio section, you have your activity section. Unlike the AMCAS section where you have a limit of how many activities, in the ERAS you can do unlimited. So if you want to have 100 different activities, you can do all that.
Do you recommend that?
No, I don't, and that's a discussion in itself. It's more so at this level, it's more so about the quality of the activity. So I'm sure in med school we all do a lot of things. You can probably fit 100 different random activities that you've done. But really what it comes down to is when you're getting interviewed, they're going to ask you about those activities. So even if you only have 4 activities, if you can talk about those 4 well, that's going to go a lot further than 100 activities in which someone asks you about it and you can't answer one of them. So that's just like my opinion, and I haven't interviewed at any schools yet, so my opinions may be subject to change. But as of now, this is what I've been told. But then you have your activity section. You also have to write another personal statement, which is probably, I would say, the most difficult aspect of this whole process. For me, it's not going well. It's not going well. Just because I feel like the character limit is smaller. Typically, personal statements for residency are only supposed to fit on 1 page. And it's hard to kind of condense why you want to go into a specialty and tell a compelling story in 1 page. And it can't be like a generic reason too. Like, we all want to go into our specialties for whatever reason. In my case, I'm choosing emergency medicine. Generic reasons for emergency medicine, I like the pace, I like the patient population, and so forth, but it's like thousands of people are going to be saying that. Yeah. So you need something unique to yourself, and that's what makes it difficult because, you might like the emergency medicine for the pace, so how can I find something more unique than that, if that's what I really like. So that's my own personal struggle, what I've been dealing with. I'm trying to write a personal statement. I've had probably 7 or 8 drafts. So hopefully draft number 9 will be the one.
That's it.
So like, what are you saying in your personal statement? You're just talking about why you want to do that residency? Or are you talking about all the glowing things of your past or your wonderful med school experience? Like, what's in your personal statement?
It gets real sticky from here. So these personal statements, they're specialty specific. So each specialty is going to want to see something different in their personal statement. I can only speak on EM. So basically EM, the 3 things you need to have answered is, why do you want to go into EM? Why do you want to go to whatever residency you're looking for? And then why they should pick you. So basically, if they picked you, like, what's good about you for them to pick? Those are the 3 things you need to cover. And you got to squeeze that into a page. And so it gets sticky because certain programs will be like, hey, that's cool, you have a personal statement, but why do you want to come to our program?
Right.
So that's a whole separate, paragraph or statement you might have to write. Yeah. So in residency, it's kind of like when you apply to med school, you apply to a bunch of med schools. Residency is the same way. The magic number, you want to try to get at least 12 interviews. You get 12 interviews, you have a good chance of matching. The match process favors the applicant. What that means is you're more likely to match it. I forget the exact numbers, but you're likely to match in one of your top 3 choices if you get at least 12 interviews. So you want to shoot for that. But in order to get 12 interviews, you got to, depending on what kind of applicant you are, you might have to apply to a lot of programs. I don't know the average, but I know for me, I'm applying to like 40, 50 programs. Again, and there's like a price tag associated with that, so that's another thing you have to consider. But so going back to the personal statements, you got to almost tailor your personal statements. You can target them by like, hey, I want to go to this specific region. If I don't have a tie to that region, I might have to address that. Or hey, maybe you had a bad score, a bad grade, you might have to address that in there. Or hey, I want to go to this specific program, I want to address that. But then you also have to be careful, because if you're saying, hey, this is my number 1, but you're saying that for like 3 or 4 different programs, that can also come back on you. So it's, there's just a lot of different moving parts that go into the residency personal statement. And then the further, I was also told this, that more or less 90% of the personal statements that you submit for residency are all going to be like just good. 5% are going to be bad, and then 5% are going to be excellent. You want to at least fall into that 90%. And so, you know, trying to figure out what are the mechanics for that is, you know, that just is trouble. And you still have your clinical duties that you would have 4th year too, so that also interferes with things to some degree. But they're not as strenuous as like third and third year, and they're definitely not anything like first and second year. So these are just all things you have to like time management and factor in.
Now, are you region specific? Are you applying far and wide? What's your strategy in?
I have regions I want. So I don't want the coast. The coasts are probably the most competitive regions to get to for any specialty. And then depending on the specialty, certain areas are hard. So for instance, emergency medicine, Denver's a really hard city to get into, or Salt Lake City is a really hard to. Not necessarily because the program is particularly competitive. It's just there's only one program there, or 1 or 2 programs there. So if you want to move into that area, it's just hard. For me, I'm mainly targeting the Midwest and the South. Particularly like South, like, well, no, I'm open to all South. And so there's a lot of programs. You got to like do your research, see programs in the cities you want, and you also just got to find out what you want in a program too. Like some people just want to, hey, I just want to move somewhere else. I don't care about the program. Some people, hey, I want to go into academia, so I need a strong academic program.
Right.
You know, some people are like, hey, I just want
to be a doctor.
Yeah, I just want to be a doctor. Yeah, I'll go where they'll take me. Yeah, exactly. So it just. There's a lot of research. There's a lot more. I feel like there's a lot more research that went into it than when you're applying to med school. You know, that's in my opinion. Because this is your life. You know, wherever you pick, you're going to be there at minimum 3 years. Yeah. If not, you know, if you pick something that has a long residency, like say you're going into neurosurgery, you're going to be there for the next decade. Yeah. So you know, so you gotta pick wisely. Yeah.
You know? Or ortho.
Yeah, or ortho. So, and I'll give an added layer to that. If you're choosing a competitive program, you might not necessarily have the leeway to just be like, hey, I want to go here. You know, if it's really competitive, you might just have to take where you get into.
Where you go.
Right.
So.
I mean, the end game is all the same, right? No matter where you go, no matter how competitive your program is, you're still that specific doctor that you want it to be.
Exactly.
You also mentioned, well, you didn't mention here, but you have said to me outside of this, is you're a non-traditional student.
Yes.
And how is that informing your decisions that you're making when you're applying to places, or how is that affecting your application for how people see you differently from maybe your contemporaries?
Yeah, so it affects me in multiple ways. So it affected my specialty choice. Since I'm non-traditional, that means I'm a little bit older when I started medical school. So I had to consider that when I picked a specialty. Do I want to pick something that's going to have 10 years of training? Because when you're in training, you can start your life, but you know you're not going to be starting your life as an attending or like a full-fledged physician. You're just going to be in training for a long time. So it's like, hey, if you're done with school, you're ready to get out, you might want to pick something that has a shorter amount of training, like a 3-year like family medicine or so forth. So it affected my specialty choice because EM has a relatively short training period. It's also affecting where I want to go. You know, if I was a younger guy, I wouldn't care if I was in the middle of Iowa for training. But now that I'm a little bit older, it's like, hey, I want to live in the city I want to live in. So, you know, I'm picking places where I want to actually live and I can see myself starting a family and moving on with my life. Yeah, so you can leverage what you did before medical school at this level too. Usually people leverage it to get into medical school, but just because you're in medical school, that doesn't erase all the stuff you were doing before. So for instance, for me, I got my business degree before I came into medicine. I know I want to incorporate that into my scope of practice as a physician. So at this stage, when I'm trying to more, for lack of a better term, advertise myself to programs, I'm still advertising that and saying, hey, yeah, I got my business degree before I came to med school. Now that I'm going into training, I'm going to bring that training from the business training from back then, and I'm going to incorporate that into my my scope of practice. And so, in a way, it just makes you a better applicant, makes you more competitive, makes you stand out in a sea of med students who are all, you know, top tier students from wherever they're from. You need things that are going to make you unique, you know, and unique doesn't always just necessarily mean business degrees or presentations or publication. No, unique are just life experiences, things that skills and stuff you've picked up. I know for EM, they like to see well-rounded candidates. So I once had saw an attending say once like, hey, I'll take the guy who was a bartender before he came into med school any day, because it's like, hey, that bartender is going to have certain skills that are going to allow him to be good with patient care, you know? And so that's where, you know, that life experience, if you will, can come in handy there, you know? And even during when I was applying for med school, I spent a lot of time just talking about the random stuff I did prior that was non-medicine related prior to med school. Then I actually talked about, like, you know, the shadowing and the research and all those, the normal things that everyone else does. So.
And how did you go about finding people, or like finding the right person? Because I think it's like you can ask somebody, but that doesn't mean it's going to be a strong letter.
Yeah. So first and foremost, when you do ask someone, specifically say, hey, I want a strong letter, and ask them if they can do that. If they can't do that, then respect their answer and then just move on. You don't want to ask someone who's going to write you a weak letter or is going to give you an okay letter, and they'll let you know. They might say something along the effect like, oh, you know, I might not be the best choice. If someone says that to you, that's them letting you know that, hey, don't ask me. You know, and don't take it personal. Like, that happens. My strategy for getting a letter was basically develop relationships with people. I've always told people the easiest way to do this is your first and second year when you have free time, start shadowing people. That's how you get your foot in the door.
The free time that we have now.
Yeah. It's not much.
During COVID?
Yeah. I mean, no, it's hard during COVID. It's hard. Yeah. It's a little bit different. This is pre-COVID. That's what I would tell people. But believe it or not, first and second year, you do just have a slightly more free time than you do third year. Because third year, your work is like a job. Yeah. So you can't just be like, hey, I'm not coming in today. You know, it's like you're working there until you go home. Yeah. So that's kind of how I would get my initial relationship started. And then I would just keep contact with them and update them as the med school progressed.
But what about for people that start a little bit later?
Yeah, no, this is no. So this is where you're gonna get the most bang for your buck, and this is where most people get their letters of recommendation at. They get them third year. So when it comes down to it, the purpose of the letter of recommendation is, hey, can I work with this guy? And do you vouch for him? You know, like, the character references are not as important because it's assumed if you're in medicine, you're a good person. You know, it takes a lot to be an a-hole in medicine and make it this far. You know. So it's like, you really want letters that are going to speak to your clinicalness. And you don't want letters, and speaking to your academic ability too, that's not as strong of a letter as well, because it's like, hey, at this stage we're looking, can I work with you? You know, if you pass your board exams, you know the minimum amount of knowledge. I don't need to know that this guy had some off-the-wall board exam. You know, because that, you know, you can have off the wall, but if you don't have any people skills, then...
I guess that's in the application already.
It's in the application already, so we don't need to talk about that. We just want to see, hey, can this guy, are they a hard worker? That's big. Are they a hard worker, and do they work well with others? Like, are they a team player is what they'll say. Gotcha. So you get that during third year. When you do your rotation, specifically, you get into a rotation of a specialty that you think you want to do, or an adjacent specialty. So, like, for instance, if you want to do surgery, when you're doing your anesthesia rotation, that's like an adjacent specialty to surgery. And you basically show up and do what you're supposed to do. Make a good impression. Once you make a good impression, you let the attending know, hey, I might ask you for a letter of recommendation. You can let them know beforehand or afterhand. I usually let them know after, just so I can gauge myself. Because you never know, you can have a bad day, and and it's like, hey, if I let you know beforehand and I have a bad day, now you have a bad impression.
It's in your head.
Yeah, you know what I mean? So it's like, I let them know and I gauge my own performance, and if I think I did well, then I go to them and say, hey, when it comes time, would it be okay if I ask you for a letter of recommendation, a strong one? And they'll say yes, and then you just remember them, and then you have to remember them because fourth year comes up, then that's when you have to ask for the letter of recommendation. But that's where most people get their letters from, is from third year rotations. So if you don't have any relationships with anyone first, second year, that's fine. Most people don't get their letters until literally they're in third year, and even if it might be a specialty you didn't even think of, you're rotating, oh, this is pretty cool. So and then boom, there's your letter. So.
What are some things that you feel that first, second years, or even pre-med students can do to stick out and to be more unique?
I say have as many experiences as possible, and I tell this anecdote all the time. So anyone who's watching this and knows me knows I tell this all the time. So I took salsa lessons before I came to med school. Wow. I learned how to salsa dance.
Wow!
I put it on all my applications that I salsa dance, and it comes up every single time. Man. Oh, salsa dance, that's interesting. Tell me about that. And it's like, and I have a little spiel. I say, oh, salsa dancing is like the physician-patient relationship. It takes two people to dance. If one person's not a good follower and one person's not a good lead, then the dance won't work. And the same is with doctors, patient. The patient doesn't follow, the doctor doesn't lead, it might not work. So use that little spiel every time.
That's good.
Yeah.
That's really good. Yeah. I might have to take some salt.
Yeah, no, but it's
that's good. Man.
But you just gotta have experiences, man.
Yeah.
And it's like there's no one. A lot of times people ask me, they're like, "Oh, what is the one thing you do?" I'm like, "No, that's unique to me."
Yeah.
It's like to your point, if you did salsa,
Now Roderick.
Yeah.
He said it's unique to us.
Okay, so I'll give you guys another example.
This is my hobby.
Yeah. I got you. I won't step on your toe. All right.
Okay, if you're not gonna take it,
Yeah.
I'll take it out of your hands.
Okay, I'll give you another example. Gaming, video games.
Yeah.
You'd be surprised just because you're some attending doctor, you don't play video games. Like, you'd be surprised they do.
Oh.
There's a section on your ERAS where it says, hey, put hobbies and interest.
Man.
Gaming right there.
Yeah.
And it comes up. You believe it or not.
Man.
I put that, I put anime. Mm-hmm. You just gotta have a well-rounded experience, and everybody has their own hobbies, and whatever you have, you just gotta be able to articulate it and then always tie it back to how that will make you a better physician, and that makes you stand out. Just going to school and doing your homework and coming back, you're not getting the most bang for your buck in med school, man. Yeah. There's so many different experiences. You have so many different people here. You can get into a lot of stuff. Yeah. And so just do that. Don't just do classes and homework. There's more to it. You gotta, develop yourself as an individual too. So that's how you get to be unique and competitive. And you'll find everyone's unique and competitive if they develop that part about themselves.
For sure.
And where did you get that time?
Oh, okay. So the salsa, that was before med school. I don't think I could do it maybe during now, but it just would be tough.
Yeah.
Anime and gaming, that's in between lectures.
For sure.
When you've had enough of lecture for the day, you turn on the TV, pick up the sticks, whatever.
For sure.
Anyone who games knows the sticks.
Yeah, you know what the sticks are.
Yeah.
It's real on the sticks.
Yeah, you pick up the sticks.
I know the sticks.
So it's whatever, and you're happy to be anything. I work out, I work that into my day. We have a group of people that hoop every Thursday, that's your hobby. We've had people do intramural sports and be competitive.
Yeah.
So it's just whatever it is you do, man. It's like everyone has a little bit of everything.
Got you.
Hiking, swimming, just cooking, even if it's something in the house, You're just like, hey, I'm cooking, that's why I want to be a doctor, because doctors know how to whip stuff up. Seriously, good dexterity, man, seriously, that's a good one, So it's like, you just gotta, you can't just be going and studying and come home and getting takeout every day. It's like, that's not exciting, so it's just.
Got you.
How did you pick EM?
Oh, I loved EM. I came into med school thinking I would do EM. I actually tried to rule it out. So I had a blast on my surgery rotation. It was tough, but I thought surgery was just cool. But the lifestyle just didn't match up with what I envisioned myself doing.
Mm-hmm. What do you envision yourself doing?
I just having more time to do me. It's like and I don't want to say anything to my surgeon colleagues that may be watching this, but for a lot of surgeons I ran into, they're like, hey, a surgeon is who I am. Yeah. So even if I'm in the OR or out, I'm a surgeon. For me, it's like, I'm a physician, but I'm also Mark. So I wanted to be Mark primarily, and a physician is what I do. It's not my identity. So I wanted a specialty that would allow me to have that. EM is shift work. So when you're off, you're off. What that means is you're not calling me in for some emergency in the emergency department, even though it's in the name, but it's, for surgeries or even like family med, it's like someone gets sick or they need a med refill, they're calling you at home when you're watching TV with your family. So it's, I didn't want that. So that kind of attracted me to it. Once I got into ED and I started seeing the variety, and I'll say this to you guys, when you become a fourth year med student, this is probably the most broad your medical knowledge will be. Depending on what specialty you pick, you're going to forget all this other stuff. So if you go into ortho, you're not going to remember all your endocrine stuff, man.
You might.
You might. We have a joke. We have a joke. The orthopedic surgeons, what's a stethoscope? They don't use it. Because they don't need it. They don't need it. Hey, bone break, I fix. That's their No offense. That's what they say. So I wanted EM. What we say is you have your knowledge is an inch deep, a mile wide, man. So it's like I know a little bit about everything, and I like that. It's like anything comes to the door, I'm equipped to handle a little bit of it. It's like I might not be the best cardiologist, but I'm a better cardiologist than the I don't know, the
ortho guy.
Yeah, the ortho guy. Yeah, exactly. I'm not the best neurologist, but I'm a better neurologist than the gen surgeon, man. So that's what I liked about it, and that's what did it for me. So I like the variety, I like the pace. It's fast. There's a lot of downtime, but when it picks up, it picks up.
Yeah.
I like the patient population, and then the EM is just the front line, man.
Yeah.
When people first roll in, this is usually the worst day of their life.
Yeah.
They're rolling in, and they get to see me first.
Yeah.
You know what I mean? I always say by the time they get up to the floor, you already know what's going on with them, man. Oh, this guy has appendicitis. This guy broke his arm. This guy had a stroke. You already know. But when they come in the ED, it's like you don't know anything.
Yeah.
And so every bit of medical knowledge you've learned up to this point, you're applying it right then and there.
Mm.
So you don't forget anything. So that's what drew me to EM, and that's why I love the field.
Yeah.
And it's not for everyone. I get that. Everyone can't be the best doctor, but I'm biased.
Listen at it.
I'm biased.
Oh man. Okay.
I'm biased. So.
Okay.
Any thoughts on subspecializing or?
Yeah. So there's EM is relatively new, so there's not too many subspecialties. I kind of touched on it with the fellowship. There's like you can go into like critical care or like a lot of ED docs. Like I think the EM subspecialty, if you will, are like ultrasound and stuff. They're just like things that help you be a better EM doc per se. But it's not like the other specialties. It's not like internal medicine. You can subspecialize in like GI stuff. It's like EM is like its own thing, and then you can maybe get out of EM into other things. Gotcha. But you can't. There's no like subspecialty of EM. Mm. So I don't know. No, there's not really. I thought about maybe doing like critical care. Gotcha. That's the extent. So.
Gotcha.
So you're a fourth year.
Yes.
So like you're almost done.
Yes.
How does it feel? So how does it feel today, just being a fourth year, and then if you could explain on just your transition and how you feel like. So okay, you're a fourth year.
Yes.
So how do you feel as being a fourth year, and also knowing that you're not going to be a med student in about a year? You're going to be a full-blown doctor. Like, has that set in? Like, how do you?
So,
have you internalized that yet?
Being a fourth year feels a lot like being like a senior in college or high school. It's like you get senioritis where you just don't want to do anything, especially if it's not related to your specialty. You really don't want to do anything.
Yeah.
Right.
And I can only predict it is going to get worse once I submit my application, and even more worse once I match. So fourth year is cool. You get there's a lot more downtime. It's probably the most downtime I've had since I've been in med school. You're done with all your board exams. Once you finish all your core rotations, which are usually front loaded, front loaded as in they're like June, July, August, and then you submit your application, you're pretty much done with all the stuff that you can more or less be graded for. Yeah. So you don't have to like go all out all the time.
For sure.
And when do you submit?
So for us, because of COVID, things got delayed. So our submission is October 21st. Typically, it would be September 21st or somewhere around there.
Oh. Wow.
So
into your fourth year.
Yeah.
Okay.
Yeah, so it comes pretty quick.
So you're submitting all of your applications to all of the programs that you want to get into by September, October of your fourth year of med school, right? So
it comes quick.
Wow, okay.
But you remember in med school, after your first year, you just go year round. So, basically for our school, we were done with third year back in April, May. So we had 3 or 4 months to get all this, and so you have enough time. It just comes quick. Yeah. But to your part about how do I feel about being a doctor next year, there's a lot of anxiety about that.
Right.
It's one thing to be a med student and we should do this with a patient plan, and they're like, a little silly student. But it's another thing when it's on you. And it's like even as an intern, there's a lot of decisions you're gonna have to make that is just you.
Yeah.
Right.
And I've been in scenarios where I've seen the intern have to make, hey doctor, what's the call? And it's, they were just a med student 3 months ago.
Yeah.
Right.
Granted, there's a lot of safety nets in place that just in case the intern does make the wrong call. But there, you still have to make the call, and it's tough. I've been told that fourth year, it's really easy to get into like this isn't my specialty. I have these next few months off. I'm gonna chill. It's really easy to do that, but I've been told that you'll forget a lot, and it does go quick. For every month or week I'm in the hospital, I'm already forgetting or getting out of that mode. So it's like, you could keep your skills sharp by doing Anki or what have you in your off time.
For sure.
Personally, I probably wouldn't. I'm gonna enjoy my time off. But it's like, hey, it's just something to consider. Try to keep your skills sharp so when you get into intern mode, you know, you're not just like blindsided, like, oh crap, what's the sugar cutoff for diabetes? Like, you know what I mean? Like, you know, you don't want that to happen to you, man. And it happens, and if it does, they get you back up to speed during intern year. They expect you to come in like, oh, this guy has probably hasn't done anything for like a month or two, so he doesn't know. So.
Gotcha.
Yeah, it's sometimes this is nerve wracking. When I think about like when I see the interns in the hospital with me and I see them like 2 phones, the pager, and the nurses are screaming at them. The patients are freaking out. Like I'm like, oh wow, like that's gonna be me. So you'll see. There's gonna be a lot of moments, you know.
So, but what is the intern?
An intern is just a naming. So intern means a first year resident, and that's what they refer to you as, an intern. So you go intern and then you become a resident after that. That's so second year on, and then they'll refer to you about what year resident you are. Each specialty and program is different, but a senior resident will just be the highest ranking resident amongst all the residents in the area. So when I was on surgery, for instance, the senior resident was a 3rd year, and the surgery is a 5-year program. So for that specific rotation. Okay. On another rotation, the senior resident might be the 4th year as the senior resident. On my last rotation in the ICU, the senior resident was also a 3rd year, but he was an anesthesiologist, but that's what he was training for. And then the junior residents will be the 2nd years, and then the interns will be the 1st years, and then there's the med students. So it was like a whole tier of people. And then we had a fellow above them, and then we had the attending. So it was like a whole like pecking order.
So they call you an intern your 1st year. What do they call you the 2nd year?
They'll usually call you whatever your year. So they'll be like PGY2. So that, I don't know what PGY stands for, but I just know that
I think postgraduate year.
Oh, all right. Well, there you go.
I never knew that either.
Yeah, I didn't know because they'll be like, oh, he's PGY7 or something like that.
Yeah.
So, but yeah, so for me as a med student, I just refer to them as like, oh, my senior. Yes. That's what I would call them. But the intern, I'll say that's my intern. So I'll be like my intern, and then everyone else is my senior. Yeah. And then the fellow and so forth. So that's kind of how the pecking order breaks down. And it's interesting. Per specialty, some of it is really rigid with the hierarchy. Like in surgery, it's really rigid. It's like, hey, there's a strict pecking order. This is how the decision tree goes. This and the other. Other specialties are a little bit more lax. It's like, yeah, that's the senior, but you know, the intern can make the call sometimes and so forth. So,
How was transitioning from 2nd year to 3rd year?
It's like getting smacked in the face.
Man.
Yeah.
Really?
It's like
already?
Yeah. Like it depends on what you transition with, you know. So I started with peds, fam, and peds is typically known to be a little bit easier going. So my smack was like getting smacked with a pillow, so it wasn't like that bad. Yeah. You know, that kind of eased me into it. But if you start off with something tough, like one of these medicine rotations or like a general surgery rotation, it might feel like a smack because it's
like a brick.
Yeah, because it's like, you know, you got to, everything you've learned up to this point is always going to be in play. Yeah. It's like patients don't present like they do in this question stem where they come in with one problem. It's like this guy came in, he has right upper quadrant pain. All right, let's see, he has a positive, what is it, Murphy's? Positive Murphy sign, so you're like, okay, cholecystitis. Boom, right there. Yep. Wait a minute, he has a fever, his chest x-ray just came back, and now he has a low burn pneumonia too. You know, and don't
issue of diabetes.
Yeah, and then he has diabetes. The BMI is 40, so you know there's probably some hypertension going on. So it's like, and you're managing all that, you know. So it's like everything you've learned up to this point, and then you know, you did the exam, hyperthyroidism or hypothyroidism. Like, it's like, and so you have to be on top of all that.
I guess that's different because we learned it in like organ systems, but it's like you have to think of it as like the whole person.
No, we learned as organ systems too, but it's the whole person. And nobody comes in with just one issue, but very rarely, you know. Like if they do, that's an easy patient. It's like most patients, if they're older, they're gonna have a mile long chart. And everything in the book is going to be going on with them, and then you know, it gets real sticky.
Medications, you have to know the adverse effects and how that plays.
Man, listen, contraindication. But listen, so the thing I like about medicine is a team sport. So even though you have to know all this, you have one of the best parts of medicine is knowing who to ask for things. So I was like, okay, I have all these medicines going on. Good thing I have a pharmacist on the team. So before I prescribe anything, hey, what would you recommend? You know what I mean? Hey, you know, I want to do this, but his O2 sats are this. Let me consult respiratory therapy and see what they suggest. You know what I mean? Or let me ask my senior, what would they do? You know what I mean? So it's like you have so many different. players, like even the nurses, man. The nurses, they've been nurses for 20, 30 years, man. So they've seen it all. Yeah. You can ask them, hey, you know, what would you do in this scenario? Well, this is what the doctors typically do. Okay, good, thanks.
Yeah.
So
nurses are dope.
Yeah. So it's
nursing.
like,
shout out to nursing.
Yeah, no, shout out to the nurses, man. Like the nurses will, as a med student, they can make or break you. They can make or break you at any point. Yeah. But they definitely save you as a med student. When you're seeing patients, they give you a quick, hey man, I noticed that the chart wasn't up there with his vitals, but I just went and checked. This is what's going on with him. You're on rounds, you present that. Oh man, good. You're on top of it. You know what I mean? So like the nurses save you a lot. Yeah. So don't sleep on them, man. They know their stuff. Got it. You know.
Bring them some donuts and
listen. Listen.
Coffee.
Hey, listen. If you didn't get with them, they'll bring that to you.
Gotcha. Hey, that's what I need. That's what I need.
That's pretty cool. It's pretty dope. It's pretty dope.
Sure.
So, do you have any advice for, I guess, us as second-year students?
Enjoy it because it goes quick. I know second year is not the best because you're studying, but just know that you're gonna look up and be like, oh crap, I'm a fourth year and I'm about to be a doctor. Yeah. This is like the last time that you'll ever be a student, like a school student. You know. So just like soak it in. Yeah. You know, soak it in. This is my last time to do that. You know, friends, family, all that stuff. So, because once you get to be in a resident, man, it's, you know, this is a job. Yeah. You know, so it's like, you know, you don't get the summer vacation, you don't get the, you know, the winter vacation, you don't get that. You get 3 weeks off. Yeah. And that's 3 weeks whenever you can fit in around your team. It's like you can't just leave whenever you want because it's like, hey, we got a lot of work to do and the team needs you. Yeah. If you leave, then that means there's more work for everyone else. So you got to schedule all that, you know. Jesus. So just enjoy it now. And people told me to enjoy it and I didn't listen. I was like, oh man, I can't wait to be done. But it's like, you know, now looking back, I'm like, you know, first, second year wasn't that bad. I mean, it was bad. Yeah. but it wasn't, you know, it was a doable bad. Yeah. You know? And I wish that I, you know, just would have just slowed down a little bit and enjoyed the fact that after I'm done with my lectures, I can just watch Netflix all night and I don't have anything to do. Yeah. I don't have to worry about some patient coding on me in the middle of the night and, you know, doing chest compressions, like none of that. It's like, I can just relax, you know. Man.
Oh, guys. Man, thank you, man. This was very informative, man. You definitely opened my eyes to a whole side of medical school that I had no idea about. You know, it's like you said, the brick coming at you at the face, like that was a really good analogy, honestly, because, you know, I don't know about you guys, but I had I'm going in blind, you know, so.
Especially now that, you know, we're basically doing telemedicine. Like, we're not practicing honestly. Our skills. Yeah. And that's a concern that I've been having is, you know, they kind of tell us how to do stuff, like through Zoom, but we're not actually physically practicing. We don't have reassurance and reinforcement of, okay, you're actually doing this skill correctly. Yeah. Mm-hmm. But in the hospital, I mean, there's no excuse, right? Like once we're there, we're supposed to know these things. Yeah.
So they'll teach you. So it's not like you come in day one and they expect you to be an attending. Like that's not the expectation. The thing is with third year, you just have to be willing to learn. So they're like, hey, you want to do these sutures? Even if you've never done sutures before, you should always say yes. Say yes and then be like, hey, I never do them. Can you show me? That's the right answer. The answer should never be no. Right. And so as long as you have that mentality, people will work with you, man. They know you're the med student. They're not going to be, and they know that you're out for COVID and you're doing telemedicine. They know all that. Like I came in, I didn't feel confident in my skills at all. Yeah. But I always said yes to everything. Hey, do you want to do this guy's neuro exam? I've never done one before, but yeah, I do. Okay, good. I'll walk you through it. And what they basically say in medicine is see one, do one, teach one. So I would see the first one, the next one I would do it, and then the next time I would teach whoever, if there's another med student who's never done it, teach it. And I'll tell a real quick story. I was on rounds, and I got asked a question about fluid resuscitation. And I suck at math, so this is like a math issue, so I had no idea. And so he was like, all right, he turns to the other med student and he says, teach him how to do fluid resuscitation, and then just walks away. The other med student wasn't even included in this conversation at all. So I apologize to him. I'm like, sorry. But he taught it to me, and then afterwards, so that was the teaching. That was his teach one, and this was my C one. And then the next day, we had another patient, and I presented the fluid resuscitation. This is how much fluid this guy's gonna get, and that was my do one. Yeah. So that's how you learn, and you learn quick. when it's like hands-on, you know. So it's like now I know how to do that. So if someone else was like, hey, what's the blue resuscitation for this guy, I would be on my teach one. So.
Okay, so have you ever forgotten something an attending has asked you to do?
Yeah.
And if so, how does that go?
Just own it. Just own it. If the biggest thing, the worst thing you can do is lie. Oh yeah, I know how to do that, and then you don't do it. Like that'll mess you over. Just be like, hey, I forgot how to do that. Again, you're a student. If anyone's expecting to make a mistake, it's gonna be you.
Yeah.
Right.
So just say, hey, I'm a student. I forgot. You know, just don't make a habit of always forgetting the same thing. But
yeah,
you know, I always be like, hey, I didn't remember how to do this, but I can tell you about it later on today.
Yeah.
And then when the later on today comes, you have to tell them. You know. So
Right.
for sure.
just don't have anxiety. It's like, you know, you're not gonna know everything. If you go in there thinking you know everything, that's gonna be bad.
Yeah.
You should go in there and be like, hey, I don't know anything.
Yeah.
You know, because like book medicine and real medicine is two different things.
Got you.
So,
For sure.
as a side note, I just want to say no shade to any of my surgery friends. You know, it's all fun and games. It's all fun and games, man. You guys have what you say about the ED docs.
Yeah.
I have what I say about it.
What do they say about ED docs?
I won't say it here.
Oh, wow.
I won't say it here.
Wow.
I'll tell you guys off camera.
Okay. All right.
Well, thank you so much for being a guest. We really enjoyed having you on the show, and you gave us a lot of insight. I don't know.
For sure.
Yeah,
For sure.
definitely.
Yeah.
Thanks. Appreciate it, man.
Oh, yeah, man. Thanks for having me.
Thank you.
Yeah.
Oh, hey, you guys.
Honestly, good luck with everything.
Thank you.
So that's our show for today. Thank you for watching. Please comment, like, and subscribe. And share with your friends. That'll be great. Thank you so much. Take care until next time.
Bye.